I am Dr. Girdhar Gyani, the Director General, Association of Healthcare Providers India. Before that, I retired as Secretary General, Quality Council of India and CEO of National Accreditation Board for Hospitals and Healthcare Providers. Such a massive scheme, if you have to run, you will need all these hospitals to be pooled together to provide healthcare to the 40% of the population. Now, what we are suggesting to the government, that let us say there are 50,000 private hospitals, and to identify the right hospital, we have to develop a criteria. Once you have a criteria, we can impanel these hospitals, and these two, public and private sector, how do they have to work together? We can actually classify, for example, secondary care procedures. We can take care in all the public hospitals, because we have got district hospital, we have got government teaching hospital, and so that those secondary care procedure can be taken care of by the government hospital. For tertiary care, we will have to depend on the specialist and super specialist hospital which are in the private sector. So that kind of division can work easily. That is going to be a key question. If you have seen now, our AIIMS model partially has not been successful because people from Bihar, from Bengal, from Odisha, even from the primary care, they all rush and come to Delhi, and first thing they landed at the AIIMS. Now, because of the poor referral mechanism, this is what is happening. So now what actually we are proposing to the government, that the health and wellness centers which are being created, that means by converting the sub-center, they should become the first focal point, and first when the patient refers himself or herself to the sub-centers, the sub-centers will identify the ailments and will decide whether the patient needs to go to a nearest district hospital, or it needs to go directly to the super specialist or specialist hospital into the private sector. Unless you design this referral system, the kind of crowd which will create at the designated hospital will be unmanageable, and we will be putting patient to the great, I think, difficulty. In fact, one of the paper which we have submitted to the government, we have told that there are 1,200 hospitals today in the private sector which are specialist and super specialist, which are accredited by NABH. Similarly, there are around 50 hospitals which are accredited under the Joint Commission and the Australian accreditation system. So let us say there are around 1,300 hospitals in all which are accredited. The first, our emphasis should be impanel these hospitals directly without any scrutiny. Later on, because this 1,300 will not be enough, we will need many more. For that, we will develop a quick checklist, and the hospital will be asked to apply whichever they want to get impaneled. Now, this checklist will be applied on that, and once we identify, they will be impaneled with the condition that within next 1 year they will get accreditation from NABH, then only they will continue to be impaneled. Why I am saying so? Because patient safety must be the strong criteria of the Government of India, and patient safety can only be ensured if you are having international accreditation. That actually, unfortunately, in India, we have not done the costing of the medical procedures. So far, the costing was done in case of CGHS by inviting tenders, which has miserably failed. So recently there was an exercise done in Karnataka where they have tried to find out the costing of 20 prominent medical procedures. I think this exercise has to be quickly done for remaining, let us say, around 700 procedures. And unless you do the correct costing, and then otherwise hospitals will not come forward to get themselves impaneled, because if you try to cut down on the reimbursement cost, the patient safety will get the hit. So we are advising to the government to do the scientific costing exercise the way it has been done with the Karnataka government, and then fix the pricing or costing of the various medical procedures.